Hello, everyone. Welcome to the fourth episode of our podcast, Mind Matters. My name is Tanuj Sharma. I'm the co-founder and CEO of Kana Health, where we are focused on transforming therapists into super therapists and enabling them with AI-powered personalized treatment recommendation and clinical decision support. Today, we are exploring something that affects many of us. It's called general anxiety disorder, or GAD. And to help us unpack this really complex topic, which touches so many of us, I have with me the incredible Nidhi Kaul.
Thank you for having me, Tanuj. I'm thrilled to be here and to talk about something that's really important.
Yeah, absolutely. So let's dive right in, Nidhi. Let's start with understanding the basics. Anxiety is something that all of us experience, right? But GAD, or general anxiety disorder, is a little different than that. So, Nidhi, would you be able to break down what exactly general anxiety disorder is and how does it go beyond the usual worries that most people experience?
Yeah, of course. General anxiety disorder, or GAD as we call it, is more than just regular anxiety. While typical anxiety may come and go, such as anxiety before an interview or before significant life transitions, GAD involves constant, excessive worry that occurs almost daily for at least 6 months. And these worries are about various aspects of life, such as work, health, finances, relationships, and they occur even when there is no imminent stressor or cause. So, a person with GAD may have thoughts like, did I lock the door to my apartment? What does that friend think of me? Did I say something stupid? What if I don't have fun on this trip? What if I'm not good enough? What if I get the promotion and then don't do well? So, a lot of negative future forecasting, which creates anxiety.
Yeah, I totally agree, Nidhi. And since this is such a common disorder, let's talk about how do someone recognize the symptoms of it, right? And I know there are a lot of listeners who are wondering, do I have general anxiety disorder? Since anxiety can sometimes blur into daily life stresses as well. How does someone recognize whether their anxiety has really crossed the line and now has become a disorder?
Yeah, so that's a great question, Tanuj. Typical anxiety becomes clinical anxiety when a person experiences a combination of symptoms that
Hmm.
significantly distress them or interfere with their daily functioning. And again, for GAD, these symptoms last at least 6 months and occur almost daily. And the symptoms could include persistent worry, nervousness or restlessness, fatigue, irritability, muscle tension, trouble sleeping, and difficulty focusing. There could also be physical symptoms like headaches and stomach aches, nausea, vomiting, heart racing, chest pain, dizziness, lightheadedness, irritable bowel syndrome, or reduced urinary control. So there's quite a few different symptoms that people could be experiencing. And then some people even develop nervous habits such as pulling their hair, picking at their skin, or biting their nails.
So I can imagine, this must be feeling overwhelming, maybe disorientating as well. And I know for me, when I'm under stress, my sleep suffers. But sounds like, for someone with GAD, these symptoms are probably far more complex, far more persistent, far more unrelenting. So how do someone deal with these symptoms, impacting their personal and professional life?
Yeah, actually, so that's when people usually seek support, is when they
Mm,
notice the impact the symptoms are having on their personal or professional life.
mm,
So they may notice that they're avoiding social situations, which can make it hard to maintain relationships, and even to engage in everyday tasks like grocery shopping or paying bills. And often, because of the persistent worry, people with GAD struggle with concentration and decision making, which can impact productivity and increase errors. At work, this anxiety can hinder communication and collaboration, leading to misunderstandings or conflicts. And it can cause people with GAD to shy away from advancement or networking opportunities, even because there's a fear of judgment or failure, which then impacts their professional growth. So ultimately, GAD symptoms can really create a cycle of stress that affects all aspects of life.
mm. Very deep impact, I must say, and there are so many myths and misconceptions around this disorder as well. Maybe it is often misunderstood, and unfortunately, there is still a lot of stigma around it. Um, you know, can you talk about some of those myths or misconception, you encounter, based on your experience of working with so many numbers of clients and patients you work with? And what would you say to clear those things up?
Yeah. So, I mean, there's quite a few myths that are out there. And one common misconception is that people with GAD are just overthinking or overreacting and that they can simply snap out of it. But
Hmm.
it's really not that simple. And another myth is that only weak people suffer from anxiety, which couldn't be further from the truth. Then there's the myth that people with GAD can't function or that medication is the only solution for them. And again, all of these are untrue. Many people with GAD are actually overachievers and perfectionists. And from the outside, you wouldn't even know that they're experiencing anxiety. And medication can be helpful, but behavioral change is also necessary to manage anxiety and to maintain good mental health.
Yeah. No, so well said, Nidhi, in terms of the overachievers, right? I mean, I've known so many people who always use their nervous energy, nervousness, which is used into positive motivation, positive reinforcement of how they're going to tackle a certain situation. And I know there are so many treatments and approaches which are out there. And, let's talk about some of those as well. In terms of treatment approaches, the solutions, the support, for those who might have general anxiety disorder or suspect they do, what are some of the effective treatment options, Nidhi, that they can take help from?
Yeah, great question, Thanuj. So, first, it's important to emphasize that there is no one size fits all approach.
Hmm.
Identifying the specific symptoms the person is experiencing is crucial, as treatment should focus on symptom reduction rather than solely on diagnosis. So, once we understand which symptoms are causing the most distress in a person's life, we can determine a treatment plan aimed at alleviating these symptoms. Cognitive behavioral therapy, CBT, is one therapeutic approach that is often used for managing anxiety. And it helps individuals understand the connections between their thoughts, emotions, the physical sensations in their body, and behaviors. And this process encourages people to recognize unhelpful thought patterns and reframe them into more balanced perspectives, while also promoting behavioral changes that can positively influence their thoughts and emotions. And then there are other forms of therapy that are effective, such as dialectical behavior therapy or DBT, and acceptance and commitment therapy, ACT. And so DBT combines cognitive behavioral techniques with mindfulness and acceptance strategies, while ACT focuses on promoting psychological flexibility and accepting thoughts and feelings rather than avoiding them. And often therapists use a combination of these approaches to provide support. And for those with more severe symptoms, medication can also be beneficial, especially when combined with lifestyle changes such as regular exercise, balanced nutrition, and mindfulness practices.
Hmm. No, as I've learned from you only, Nidhi, right? I mean, finally, it comes down to that: how will you handle anxiety situation on your own? That are you trained enough? Do you know how to handle these situations? How do you work around your thoughts, when you feel in that situation? And I love listening to all of these solutions, especially CBT, which seems to empower people to really take control of their own thoughts, really handle these situations better. But do you find that therapy combined with lifestyle changes tends to create the best outcome? Because therapy is also a lot more about what you're working with yourself rather than just depending on your therapist.
Yeah, absolutely. It's really a combination of approaches that are tailored to the individual experience that's going to be the most powerful. And building a routine around self-care, exercise, and mindfulness all help reinforce the therapeutic process.
Okay, wonderful. So, now that we have talked about the solutions and the therapeutic techniques, let's talk about some of those practical tips and techniques, for our listeners today who might not be ready, or able to pursue therapy yet. What are those small things, practical steps, things which they can do on their own, they could take to manage their anxiety daily and really, understand their self-being and being able to control it?
Yeah. Well, there are many helpful strategies that I often discuss with my clients. Today, I'll just talk about the ones that my clients have found to be the most effective, or more recently, I can share, I've heard have been very effective for them. And I'll mention three of them.
Hmm.
So, one is that when you catch yourself catastrophizing or making negative predictions about the future, such as, what if I don't do well on that presentation? Or what if my partner leaves me? Try to come up with 2 to 3 positive alternatives for each negative thought.
Hmm.
So, for example, instead of thinking, what if I don't do well on that presentation? Reframe it to, what if I do an amazing job? What if everyone finds the information really helpful? What if I get a promotion because of this presentation? Recognizing that for every negative prediction that you have, there's an equally plausible positive one can be really empowering. And it can impact then how you feel. And then, of course, how you choose to act. Okay. So, another simple technique is a mindfulness based grounding exercise called 5, 4, 3, 2, 1, where you identify 5 things you see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So if I were to do a shortened version of this right now, I'd say I can see your face on my screen. I can feel the texture of my sweater against my skin. I can hear the buzzing coming from my laptop. I can smell the scent of coffee. And I can taste the lingering flavor of the banana I was just eating. And this exercise helps redirect your attention from anxious thoughts or any other thoughts for that matter, and brings you back to the present moment. And then the last strategy I'll mention is movement. Whether it be dancing, doing jumping jacks, walking, or running, engage in some form of movement. Physical exercise has a profound biological impact on the body. It triggers the release of endorphins, which enhance mood and create feelings of happiness while simultaneously reducing levels of cortisol, the stress hormone. And then beyond its biochemical effects, exercise serves as a powerful distraction from anxious thoughts. Personally, I find that when I'm focused on catching my breath, there's little room for worry or to be thinking about anything else. So even that brief reprieve from racing thoughts can be incredibly beneficial. And this combination of physiological changes and mental diversion makes exercise a valuable tool for managing anxiety.
Wow. Well, there you go. The incredible Nidhi call. She said it. 5, 4, 3, 2, 1. Little bit of dance, and you're there. You're golden. Thank you, Nidhi. Those were actually the golden words. Really, really appreciate those insights. I think it's so valuable to know that there are so many tangible steps people can start with right away. It is not an overnight fix, but these are simple techniques which you practice on your own will definitely help your day become better and better with simple practices and simple steps which you can take on your own. Now, let's talk about the encouragement and the hope part, right? I know there are so many people who might be feeling really overwhelmed. Hearing all of this information can feel both hopeful as well as intimidating. Nidhi, what would you say to someone who's feeling a little unsure about their own ability to manage or even seek help about their anxiety?
I'd want them to know that they're not alone. Help is out there, and taking even one small step, like reaching out to a friend or doing the grounding exercises that we just talked about, that's progress. And seeking support, whether it's through therapy or just talking to a trusted person, can really be life changing. So I just encourage them to acknowledge that they are not alone in experiencing this and to seek support wherever they feel comfortable doing so.
No, wonderful, Nidhi. That is so powerful. And I think people, often underestimate the value of first small step. It is like they're taking back control, even if it is in the smallest way possible. And that's definitely worth celebrating. Well, Nidhi, thank you so much for all these insights and reassurance for someone dealing with general anxiety disorder or supporting someone who is.
Thank you, Thanuj. And, I really do hope that this conversation helps our listeners feel seen and understood, and that it sparks even a small amount of hope.
Wonderful. Thank you, Nidhi. Absolutely. To our listeners, remember, you're not alone in this. There are a lot of resources and support available. Stay tuned for our next episode. Until then, take care of yourself. Thank you, Nidhi. Take care. Take care, everyone.